All right, welcome future pharmacists. What's the real difference between a drug that heals and a drug that harms? A lot of the time, it just comes down to one single number, the dose. And the science of figuring out that perfect number, well, that's a cornerstone of the career you're just starting. It's called posology. So let's get right into it.
So, here's what we're going to cover today. First, we'll get a solid handle on what posology actually is. Then, we're going to jump into all the real-world factors that can make dosing a huge challenge. After that, we'll look at what happens when you've got multiple drugs in the mix, and we'll finish up with something super important, how to calculate doses for kids. Okay, Section 1. What is posology? Look, this is all about answering what might be the single most critical question of your entire career. For this person, right here, with this specific drug, how much do I give? Getting that right, that's your job. It's your core responsibility. Now, that's the textbook definition, and it's fine, but I want you to think about it a different way. Imagine you're a tightrope walker. On one side of the rope is the goal, the therapeutic effect, making the patient better. But on the other side, that's toxicity, causing harm. Pharmacology is the science that keeps you balanced right in the middle, in that sweet spot where the medicine works and it's safe. You're going to walk that tightrope with every single patient. And hey, if you ever forget, the name itself is basically a cheat sheet. It comes straight from Greek. You've got posos, which means how much, and logos, which means science. It's literally the science of how much. Sounds simple, right? Well, as you're about to find out, the practice is a whole different story. So let's build on that and move into our next section. We know the goal is to find the right dose, but the real question is, the right dose for who? Because if there's one thing you need to burn into your memory today, it's this. In the real world of medicine, one size fits basically no one. The whole idea of a standard dose is pretty much a myth. Which brings us to this really important question. Whenever you see average adult dose written on a drug label, your first instinct has to be to question it. You have to ask, okay, but is this actually right for the person standing in front of me? And you know what? More often than not, the answer is going to be no. Your ability to figure out why, well, that's what's going to make you a great pharmacist. Now, take a look at this list. It's not just the stuff you'd expect, like age and weight. Look closer. Time of administration. Did you know some cholesterol drugs just work better if you take them at night? Or check out emotional factors. Yeah, things like severe stress can literally change how a person's body processes a drug. Every single one of these is a variable that you might have to account for. Let's dig into age for a second. Think of the liver and kidneys as the body's main drug processing plants. In little kids, those plants are still being built. And in the elderly, well, they might be running on older, less efficient equipment. In both cases, a dose that's normal for an average adult can quickly become overwhelming and even toxic. And then you've got body weight. This is so important. Almost all standard adult doses are based on this imaginary 70-kilogram person. So if your patient weighs 45 kilos or maybe 120 kilos, that standard dose isn't a hard and fast rule. It's just a suggestion. It's a starting point. And your job is to make the right adjustment from there. And this is where your knowledge can literally save a life. Let's take an antibiotic like streptomycin. It gets cleared out of the body by the kidneys. Now imagine your patient has kidney disease. For them, that exit door is basically half shut. The drug can't get out properly. It just builds up and up and up until it hits dangerous levels. You are the safety check. You're the one who's supposed to spot this and stop it from happening. Okay, let's move on. Up to this point, we've only been talking about one drug at a time, but we all know reality is way messier than that. A lot of your patients are going to be taking multiple medications. So think of each drug as a player on a sports team. What happens when you put them all on the field together? Do they work together? Do they get in each other's way? Let's take a look. This table here breaks it down nicely. First, you've got antagonism. This is like one player on the team blocking another player's shot. One drug just cancels out the other one. A classic example is using an antidote for a poison. Then you have an additive effect. This is just simple math, right? 2 plus 2 equals 4. But synergism, now that's where it gets really interesting. With synergism, 2 plus 2 equals 5. The combined effect is way bigger than you'd expect. It's an incredibly powerful tool. Okay, 2 more terms you've absolutely got to know inside and out. Tolerance and tachyphylaxis. Think of tolerance like your morning coffee. The first time you had it, you were buzzing. But over months or years, you need more and more to get that same effect. it's a slow process. Tachyphylaxis is completely different. Think of a decongestant nasal spray. The first day, it's a miracle. By day 3, nothing. It just stops working, like overnight. And taking more won't help because the receptors in your body have just temporarily shut down. Knowing that difference is crucial. And speaking of different responses, that takes us to our final section. And honestly, this is probably the most high-stakes topic of all. We already said age is a factor, and nowhere is that more true than with kids. When you're calculating a dose for a child, the margin for error isn't just small, it's basically zero. This is all about precision.
And to get that precision, we have very specific tools. You might look at this and think, why are there so many different formulas? Well, it's because the way an infant's body works is totally different from a 10-year-old's. So each of these formulas is designed for a very specific stage of development. It gives you a much more accurate place to start. But going beyond just age, using body weight gives us an even better result. A classic formula for this is Clark's formula, and the logic behind it is actually pretty cool. It just figures out what fraction of a standard 70-kilo adult the child is, and then tells you to use that same fraction of the adult dose. It's a really smart, logical way to scale a dose down safely. But really, the gold standard, especially in critical areas like cancer treatment, is body surface area, or BSA. Here's why. It turns out our body's metabolism has more to do with our surface area than just our weight. So BSA gives us a much better picture of how the body will handle a drug. Formulas like capsules use this measurement to get incredibly precise pediatric doses. So we've gone through the definitions, the factors, the interactions, the formulas, all of that. That's the science of posology. But I want to leave you with this final thought. A formula gives you a number. It doesn't tell you about the patient's other health problems or the other 4 drugs they're taking. Knowing when to rely on that number and knowing when your professional judgment tells you that you need to rethink it, well, that's where the science stops and the art of being a pharmacist truly begins.